Nursing home residents only represent 0.6% of the US population, and yet they are about 40% of all the deaths in the United States. And we have to think about the background about nursing homes to begin with. For the last 20 years, there have been serious quality of care problems in nursing homes. And about 70% of all nursing homes are for-profit, and they're trying to make money by cutting the staffing levels, by keeping the wages, benefits low, and not providing health insurance. And we know that before the virus hit, 3/4 of all the nursing homes in the US had inadequate registered nurse staffing levels, and 63% had infection control violations. So then when the virus hit, it definitely has spread like wildfire through nursing homes. And we you heard about one study that was done, but we have a new study that has just been finished for California, looking at nursing homes that were more likely to get the COVID virus. And we know that if they had low registered nurse staffing, they were twice as likely to get the virus. And if they had low quality of care, and they were large in size, they were much more likely to get the virus. And once the virus is in the facility, it can spread rapidly because so many staff and so many residents, possibly as much as 50%, are asymptomatic. And so we've had very inadequate testing in nursing homes. We also know that minorities are more likely to be placed in nursing homes with the poorest quality of care, with the lowest staffing and the most efficiencies. And of course, many of the staff who work in nursing homes are from minority groups. And they are at very high risk because of the lack of testing and the lack of masks and gowns and PPEs. The nursing home workers, especially nursing assistants, receive very low pay, and they generally have no sick leave. So they're reluctant to stay home when they're sick. And they also usually don't have health insurance. And so because of the low pay, many of them are actually living under poverty rates and are eligible for food stamps. And so they commonly work more than one job. And so then that we know from the studies by the CDC has helped spread the virus from across different facilities. And especially because many of them don't know that they have the virus because they don't have symptoms. So this is a perfect storm for nursing home residents and staff to contact the virus, and it's continuing to spread because of the slow testing and the slow use of PPE and the poor policies and the poor oversight by the government. So I think and we do have an important opportunity to try to understand the problems of nursing homes and to make some policy corrections in the future that will prevent infections and help us address this current emergency crisis. 20 states have already granted nursing homes immunity, and part of that is based on this narrative that is being put out by the nursing home industry that they were just in the wrong place at the wrong time. They didn't have anything to do with this infection spreading. And yet we know that's not true. Many of the worst outbreaks have been in these worst homes. And there's definitely been negligence involved in many cases. And it's not only the shortage of the testing and mask, but I think negligence with the lack of staff and infection control. So I'm very opposed to granting immunity. If they can take the family members home, that would be the best thing they could do. But in many circumstances, they're unable to do that. Right now, we're very upset about the restrictions on the visitation policies for family members.
Right.
We are trying to organize to demand that the governors let family members go back into the nursing homes. Of course, they need to wear masks and gowns and be careful. But we need to have them in there helping the residents and being able to communicate with them, because we know residents are grossly affected by the loneliness, the isolation, and the lack of staff. They're not getting good care. They're not being helped with eating and drinking, and some of them are dying of dehydration and other problems. So we need the residents, the family members, back into the facilities.